Hello everyone, this is Annie Sherlin and Nikhila from KMCH College of Pharmacy pursuing PharmD first year. In this video, we are going to learn about a particular drug and its reported adverse reaction and also what you should do when you experience an adverse reaction. So let's get to know something new from this video. Disclaimer: this video is for informational purposes only and it is not intended to be a substitute for medical advice from your physician. All information in this video is referred from Lexicomp drug database. First, let us know what is an ADR, adverse drug reaction. An adverse drug reaction is a harmful, unintended result caused by taking medications. ADRs may occur following a single dose or prolonged administration of a drug, or result from the combination of two or more drugs. In this video, we will be focusing on one particular drug, that is Diclofenac. We will be discussing the description, the uses, the formulations, the contraindications, and most importantly, the adverse drug reactions. Diclofenac is a non-steroidal anti-inflammatory drug. These can reduce both pain and inflammation of chronic disorders, but these do not alter or modify the disease process itself. We can say Diclofenac is a painkiller. In what conditions do we mostly use Diclofenac? It can be acute musculoskeletal pain, arthritis, gout, spondylitis, migraine, post-operative pain, and many more. What are the available formulations of Diclofenac? Tablets, capsules, injection, eye or ear drops, suppositories, and gel. Let us also know what are the contraindications. Porphyria. Avoid injection containing benzyl alcohol in neonates. History of gastric ulcer, bleeding or perforations. History of asthma, moderate or severe renal impairment, hypovolemia, and dehydration.
Diclofenac affects various parts of our body, causing different adverse reactions. The area may be ophthalmic, systemic, or topical areas. First, we'll see about the ophthalmic area. So from the pie chart given here, we can see that in the ophthalmic area, lacrimation is observed in most patients, followed by keratitis, pruritus, and facial edema, which are some of the other conditions. First, we'll see about transient burning. This occurs in the eye when there is pressure on a nerve and it disappears gradually as the pressure is relieved. This is often referred to as burning eyes. The next one is lacrimation. Lacrimation is nothing but the secretion of tears that occurs because of any abnormalities. Increased intraocular pressure. Intraocular pressure refers to the pressure created by the continual renewal of fluids within the eye. So if this pressure increases, it causes ocular hypertension, which further leads to glaucoma. As we can see here, the next one is keratitis. It is commonly known as corneal inflammation because the clear tissue on the front of the eye, that is cornea, is affected. Facial edema is puffiness caused by inflammation of facial tissue. The last one is pruritus. It's an uncomfortable, irritating sensation that creates an urge to scratch any part of the body. The second one is systemic ADR. From the pie chart, it is visible that edema is observed in most of the patients when compared to other conditions like limb pain, nausea, constipation. As you can see here, edema depicts swelling which is caused by the fluid trapped in your body's tissue. Constipation and diarrhea are commonly known to most people, where constipation occurs when bowel movements become less frequent and stools become difficult to pass. On the contrary, diarrhea is loose and watery stool during a bowel movement. As we saw in the ophthalmic area, pruritus is observed here as well. The next one is nausea. Nausea is an uneasiness of the stomach that often comes before vomiting. The other one is sinusitis, which is a condition in which there is an inflammation or swelling of the tissue lining the sinuses. The last type of area discussed here is the topical area. According to the pie chart, pruritus and rash are the conditions that affect majority of people. Some of the other conditions are scaling, xeroderma, contact dermatitis. Contact dermatitis is known as a skin rash that is caused when the patient comes in contact with certain substances like an irritant or an allergen that might irritate the skin. The next one is xeroderma. It is a hereditary condition characterized by extreme sun sensitivity. Rashes. As we can see here, this causes abnormal changes in skin color or texture. The other condition discussed here is desquamation, commonly called skin peeling, which is the shedding of the outermost membrane or layer of tissue. The last one discussed here is erythema, which is derived from the Greek word erythros, meaning red. It is a type of skin rash caused by injured or inflamed blood capillaries.
For more information, you can contact the Drug and Poison Center, KMCH College of Pharmacy. You can also report your areas to the toll-free number, email ID and website given here. Thank you.